Hey, it's Dr. Pete Angelelli. We're here at Good Life Fitness in Milton, which happens to be where I work out. I do recommend all my patients weight train. It's so important to maintain muscle mass, bone density, coordination, joint health, and so much more. And resistance training can help with all of those, especially as we age. Today, we're going to be going through a few exercises that can cause problems. Now, if your body, particularly your spine, certain joints, don't have the prerequisite amount of health and motion, then these exercises can cause pain and aggravate injury. I see a lot of patients come in the office who would like to start a workout program, but can't because when they do, they get pain. The reality is if your spine is not healthy enough, then these exercises may aggravate problems, cause pain, and totally derail your workouts. Not what we want for you to be healthy and strong as you age. We're gonna go through 3 common areas where issues can happen. I'm gonna show you different exercises that can be a challenge for that. And then we're gonna go in the office. I'm gonna show you how we correct that so we can keep you functioning, feeling, and living well, and keep you working out here in the gym. So one of the best exercises for things like building muscle and holding on to bone density is the barbell squat. Now, this is a great exercise, but as we mentioned, if you have some pre-existing issues, this exercise can be challenging, can cause pain, and if you can't do it, you can't get the benefits. So when we're doing a squat, we do need to have a certain amount of health and mobility of the SI joints. I have a lot of patients that come in and tell me that when they do a squat, they'll get pain one side or the other in the area of the SI joint. That's typically because they may have a hypomobility, loss of motion on one side, and a hypermobility on the other side. So we have some fixes in office to restore normal motion to the SI joints, keep you squatting in the gym. So as you saw in the gym, SI joints can be a real problem area that cause low back pain and pain radiating into the glutes and the side of the leg. So we have our patient here, and the SI joints are here and here. And one of the ways we check them in the office is we can do a seated palpation where we push on the joint and check from side to side, see how they're moving. One of the other ways we can do that is with our patient lying down. So when we compress the SI joint, the patient may say, oh, that feels stiff or that hurts. Just doing this test doesn't mean that they don't also have problems with their lumbar spine or a disc herniation or those types of things, but the SI joints are commonly overlooked as sources of low back pain that really interfere with people's ability to do things like squats and deadlifts because there's chronic sprain to that joint, and that can limit your progress in the gym. So as a chiropractor, there's 2 things that we can do to help patients with this issue. One is to adjust the SI joints, get them moving. Now the SI joints don't move a lot, but if one or both are not moving properly, that can be a definite cause of low back pain and pain that radiates into the glutes and the leg. So how we correct that is by restoring normal movement to the joint with an adjustment and giving our patient exercises. So I'm gonna show you those right now. So this stretch for the SI joints is best done on the floor at home. You can use a yoga mat or an exercise mat or a carpeted floor. So we're gonna have our patient keep their legs straight, lift it up, and then bring it over to the side as far as they can. So of course, if you're on the floor, your leg is gonna eventually reach that point. And I will ask the patient, because it's not just about how this stretch looks, but where you feel it. You should be feeling it in the area of the SI joint. Do you feel that there? Mm-hmm. If you don't feel it here, sometimes you might feel it in your mid-back or the side of your leg. You may have to change the position of your knee, bring it up a little bit, bend it a little bit, bring it over a little bit further. Some patients, when they bring their leg up like this, they're gonna feel a pinch in the front of the hip, which may indicate a hip joint problem. If that's the case, this stretch you want to avoid because we don't want to aggravate your hip. Okay, so here's the SI joint adjustment. I have my patient side lying. Bring them over to me. Connect with that joint. Oh, already moved, but get it? Good. So put a force in there, got some movement with the joint. Often this adjustment will also move some of the lower lumbar spine, which can definitely give relief to lower back and SI joint problems. Another issue we can have with barbell squats is they can cause compression of the base of the neck, the CT cervicothoracic junction. So when the bar loads through here, and just stand up with the bar for us, this bar is compressing about a span of 3 or 4 vertebrae here in the upper back. So imagine like Lego bricks getting crushed together. And if you're doing this, particularly with a significant amount of weight, day after day, year after year, this area of the spine can lock up. We can get neck pain, we can get headaches, we can get pain that starts to affect the shoulders and cause numbness and tingling in the fingers, all from problems because of a loaded bar here. So again, this is a really good exercise. We don't want to give it up, but we do have to take care of this area. We're going to show you how to do that in the office. So another problem that I see really common, and I've had this myself in people who weight train, is pain at the base of the neck. A couple different ways it can manifest. It can manifest as the dreaded waking up with the kinked neck where you can't turn your head. So it can definitely limit head rotation and neck movement. Or it can be just a constant ache at the base of your neck. Patients will come in and tell me, I feel like I need to be decompressed through there. One of the big causes for this, like you saw at the gym, is an exercise like squats, where the bar is gonna sit on the upper back. So these are the thoracic vertebrae, 1, 2, 3, and 4. And when your squat bar sits on there, and your squat bar might be 100 pounds or 200 or 400 pounds, it creates tremendous compression through these upper thoracic vertebrae, and they can almost become stuck together, causing pain and stiffness. And if that loss of joint motion is not corrected over time, we can get arthritic changes to the joints. We definitely don't want that because we want to keep working out as we get older. So let me show you how we can correct this. All right, so once we've adjusted this patient and got their upper thoracic, lower cervical area moving better and feeling better and functioning better, we're gonna give them some work to do at home to keep that area properly mobile. So the first thing we're gonna do is kind of sort of a chin tuck, but not exactly. So I'm gonna teach my patient to push their chin in, bring their head down, and from here, try to bring their chin even further. That is separating these upper thoracic segments in a direction called flexion. And I may even have my patient put their hand on their head. So come back down like that, tuck the chin in, and pull down gently. Do you feel this stretching through here? Yeah, so you're gonna hold in this position, and we can even have the patient do what's called a passive end range hold, where they take their hand away and they try to maintain their neck in this stretch position. So let's take your hand away, keep that chin tucked. Do you still feel the stretch through here? Perfect. So the second movement to keep that cervicothoracic base of the neck, upper back area moving properly is a cervical extension exercise. So you can do this with a resistance band. This is a 25 to 50 pound band, which works nice for most people. So we're gonna have our patient bring their arms, pulling the bands forward, and we want this band at the lower part of the neck almost. I'm gonna adjust it, just let go of that for a second. I'm gonna bring the band down a little bit more, and then just put your arms out to the side and then forward. Perfect. And then from here, you're gonna push your neck into the band and look up slowly. Okay, and then come back and push. So this is helping to move these segments in the opposite direction backwards, which is called extension. And this is a really good exercise also for people with neck pain. This is something you could do, 20 reps a day, something like that to start with. Again, better to do when your neck pain and upper back pain has been resolved with chiropractic care and making sure that those segments are functioning better before you do the exercises. All right, so to open up space in the lower neck and upper back, we have a couple different adjustment options. One is what's called a long axis distraction. So you may have seen different versions of this online. The way I like to do it with many of my patients is by using a gown. So we're gonna have our patient just slide down a little bit, and we just wrap. Don't do this at home, leave it for your chiropractor. And this just allows me to get some grip onto the neck, and then I'll do a gentle pull like that. And often patients will feel a separating release in the upper back. This can also be done with a Y strap, or in some cases, just lift your head for me. I will do this with patients just with my hands, where we'll grab the jaw and pull. So another really nice way to get movement, particularly extension into the cervical thoracic upper back area, get relief from stiffness and pain there, is to do patient face down adjustment. This is another patient favorite. So we're gonna have our patient turn their head to one side. I'm gonna get a contact on the T1 vertebrae with my thumb and take that to the end range and thrust through. So I'm gonna try that one more time. So another area where often people will have issues before they even get to the gym is this upper back region where the ribs attach to the spine. There's joints there called the costotransverse joints. If those joints get irritated, if they lose their mobility, we'll have tight muscles through here. And an exercises like rows can cause a lot of irritation. And that's when you'll feel like the feeling of a knot between your shoulder blades. Usually it's one side, could be both sides. This can be a really annoying pain. If it gets bad enough, it can cause tingling into the arm, radiation and pain into the arm. No good, and that's gonna definitely cause issues with your workouts. So you can see when you do this exercise, when you come back, the scapula moves backward a bit. When she goes forward, the scapula comes forward and there is some motion where these ribs attach to the spine. So if we are very stiff and tight through there, this exercise will cause pain. You won't be able to do it properly, and that's definitely gonna be an issue. So we're gonna show you how we can deal with that in the office, keep this area and these tissues healthy, keep you in the gym. So another real common problem area in people that work out is pain in the upper back. Patients will often come to me and say, "Doc, I have shoulder pain." I ask them to point to it and they're gonna make this kind of motion. They reach back, they'll say, "I have a knot in my upper back." I get massages, I foam roll it, I stretch it, it won't go away. So what is actually going on there? In most cases, this is a problem with a joint in the upper back called a costotransverse joint. Now you don't have to memorize that, but costo means rib, transverse is the side of the vertebrae. So each rib attaches to the spine and forms a joint there. When those joints get stuck and don't move, they get irritated. And when that happens, the muscles over top will get tight and you'll feel that tight knot sensation back there. And this is a really common thing that happens in people that do like seated rows or one arm rows, because those movements require not only motion of the scapula and shoulder, but motion of these ribs where they attach to the spine. So with our spine model here, you're gonna see the vertebrae, and these parts off to the side are called the transverse processes. Well, these are where the ribs attach and form joints. And you can see that if a person bends or twists, the spine rib articulations will have a little bit of movement. If that movement is lost, we're gonna get pain and muscle tightness here. So there's a couple ways we can deal with that. Okay, so to adjust the costotransverse joints, as a chiropractor, I have a couple different options. Some of them we can do with our patient face down, which is called prone, and some with patient on their back. So if we're gonna do a prone adjustment, I will find the joints that are the culprits, and I'm going to take a contact on them, just stretch that area a little bit and drop through. Got a nice release there. This is a really nice adjustment. The other way we can adjust those joints, patient lying on their back, it's called supine. This is a really cool adjustment because often we can get releases of the AC joint and the shoulder along with the ribs. It's kind of a patient favorite. So to do that, come in here. Yeah, good. And just let your head roll back. And so with my bottom hand, I'm connecting with those joints that are stiff on our patient. And I just do a little push. And we got a nice release there. It's a really effective adjustment, can bring a lot of relief. I want to mention too, with these chiropractor videos, you might think, oh, one adjustment and I'm cured or I'm fixed. A lot of times we require a series of adjustments depending on how much stiffness, scar tissue, even arthritic change there are to joints. But over time, really great changes can happen, which can make a huge difference for how you feel and how you perform in the gym. So once chiropractic adjustments have got that costotransverse joint moving and functioning better and pain has reduced, this is a really good stretch. So we're gonna have our patient go into what is known as child's pose in yoga. So we're just gonna drop down, your butt is gonna go towards your heels. And then to stretch the right or the left side, for instance, in this case, we're gonna stretch the right side rib joints. We're gonna have our patient bring their right arm through and you're gonna drop down, and head can even lay on the table. Now, let your hips drop a little more. Do you feel it right through here?
Yeah.
Great. And you can even, if you're doing this by yourself, you may have to reach your arm through, or you can have a partner pull your arm through a little bit more, and you can see it opens up this interscapular space where the ribs and spine meet, also stretches the muscles here, the rhomboids. So this is a great stretch for upper back problems. Again, once those joints are moving better after you have been adjusted. All right, so we reviewed 3 different areas of the body that are commonly injured in weight training, how we can approach them from a chiropractic perspective, giving you some stretches. Hopefully this will help get you back in the gym so you can stay functioning, feeling, and living well. I'm Dr. Pete. We'll see you on the next video. Please be sure to like, subscribe, and ask your questions in the comments. And be sure to stay tuned because we're gonna have more content like this that is gonna help you get the most out of your body and life.